This is Matthew Neighbor delivering his speech for Fundamentals of Speech. Here you go. Okay. So today I'll be talking about proton therapy. So when we're treating cancers where surgery is not sufficient enough to cure the patient, we may use radiation therapy. Now, traditional radiation involves X-ray photons using an electron beam. And if you know anything about X-rays, it goes in your body and then out. So where the tumor dose gets dosed from the beam, but also healthy normal tissue as well. Okay. Now, according to the National Cancer Institute 2020, proton therapy delivers a beam of proton particles that stops at the tumor. So it is less likely to damage nearby healthy tissue. So let me explain how that works to help you decide if proton therapy is right for you. With the use of the cyclotron, we separate the protons from hydrogen gas. Now, the hydrogen gas gets sent into this bore here, where it gets met with a magnetic force with an electrical charge. So the electrical charge changes these plates, which are called Ds, and they interchange and fluctuate in positive and negative magnetic fields. Right? So the proton, if you remember anything from science, protons are positively charged. So when they meet a negatively charged magnetic force, they are attracted to it. Now, when it changes and fluctuates, that proton just spins around the cyclotron, trying to chase that negative force. And as it's doing so, that interchanging also accelerates it faster than the speed of light. Okay? Now, as it gets up to speed, it's going to go down this waveguide here, which is going to get sent down to the gantry where the patient will lay. And the beam is delivered to that patient, and the protons are delivered into their tissue. Now, we have different types of beam techniques when we're using proton therapy. What you see here are what we call compensators. Now, these compensators are pretty much just like molds that we put in the head of the gantry where the beam is going to go through. So we conform it to each patient, and it's really customized to the patient. And what it does, it kind of just like, if you know what like a laser pointer is and how you can make different shapes and different, symbols with a laser pointer, it's kind of like what we're doing with these compensators. They form that beam to conform to the tumor. And that is called passively scattered particle therapy. The second beam technique is called pencil beam scanning. This one is a little bit more sophisticated than the prior one, because what it does is, instead of using these devices that we put into the head of the gantry, it actually just controls the power of the beam. Well, with the use of a modulator that interferes with the beam, it can control how deep the beam goes into the tissue. Thus, it's just kind of like painting the tumor as it delivers the beam, and it can stop in certain places with the control of energy. It is more conformal and way more accurate than using the X-rays. So this is just kind of like how to explain how that whole thing stops inside the tumor, right? How does the proton beam just stop? So during history, we just figured out when we deliver these proton beams, there's something that's called Bragg's peak. Now, the proton goes through the tissue, and it just stops in a certain area controlled by the amount of energy that we push through. And Bragg's peak shows the dose where it falls off completely at 0%, where there's no more dose being delivered to the body. So let's say we're going to treat the liver, and we're just going about 3 cm deep inside the body. It's not going to exit like an X-ray would. With X-rays, they will just go through you and through the liver, delivering more dose out to the exit point. So Bragg's peak is just where it shows you on a graph that the protons are delivering its dose to a specific spot, and then just drops off and just does not deliver anymore. Okay. So protons as treatment for cancer. So protons are 2,000 times heavier than electrons, and unlike X-ray beams, they have a certain limit drop-off when interacting with the body. That's the Bragg's peak that we were talking about. And X-rays travel in through one side of the body and exit out the other. With certain calculations and power, proton energies can be controlled and limited to stop at a certain point in the body. In comparison to X-rays, this can be more beneficial to the patient where they may not experience as many side effects. Why? Because you're not delivering beam to other places. It stops where you need it. Okay? And the types of cancer that we can treat are just as many as we could treat with X-ray photons, just with more accuracy. So why is proton better for you? Well, for one, it's precise in its dose delivery. It minimizes radiation exposure to normal healthy tissue, and it has greater conformity to the tumor because those X-rays aren't going further. It stops, right? So it's greater conformity, and the higher treatment success rates. Why? So if you can see here, this is kind of like an example of how the X-rays will have multiple fields, different angles going into the brain here, and it goes in and then it goes out. So now with proton therapy, we could just isolate the tumor itself and just target this one area instead of treating these healthy areas, which we don't want to treat. So in conclusion, proton therapy is a better modality for cancer treatment due to its precise accuracy, higher dose to the tumor, and the ability to spare more healthy tissue compared to traditional methods using X-ray photons created with electrons, thus reducing the side effects of radiation treatment. With tumors located near critical areas such as the heart, brain, and liver, we can target tumors without risking damage to these vital organs. So reach out to your doctor to see if proton therapy is right for you, and let's beat cancer.
Very good.